Hi, thanks for watching another episode of the Doctor Podcast Cykiert File Show. And as usual, I'm your host, Dr. Robert Cykiert. Thanks for watching today. I really appreciate it. We would also greatly appreciate it if you could subscribe, follow, like, repost, and share this Doctor Podcast episode so we can get additional great guests like we're going to have today. And today we're talking about a topic that everyone's interested in. It's in the news more and more. It's on TV, it's on the internet, it's on Instagram and TikTok. You can't escape it. And that topic is plastic surgery. And today, our two guests are some of the top plastic surgeons in the USA coming from North Carolina. Our first guest is Dr. Bill Cortesis. He's a board certified plastic surgeon specializing in cosmetic plastic surgery. He's the co founder of the Health, Knowledge, Beauty, or HKB cosmetic surgery practice, which is a premier aesthetic surgery practice with over 10 locations in the Southeast USA, and it's based in Charlotte, North Carolina. He's published numerous papers, book chapters, and topics of breast surgery, body contouring, facial aesthetics, and other plastic surgery topics. He's recently been named by Newsweek magazine as a top plastic surgeon in the field of breast, face, and liposuction surgery. Dr. Cortesis mentors medical students and plastic surgery residents from UNC Chapel Hill and Wake Forest University, and he teaches fellows from the UNC Plastic Surgery Department. And our other guest is Dr. Gore Baharti. Dr. Baharti is also a board certified plastic surgeon and is also a co founder of the HKB cosmetic surgery practice with Dr. Cortesis. He has tremendous experience spanning the spectrum of facial, breast, and body procedures. He's also on the Newsweek Top Plastic Surgery list, and he's also a Charlotte, North Carolina top doctor. Dr. Baharti is a mentor, speaker, author, industry leader. He's dedicated to advancing the field of plastic surgery by introducing new devices and technologies which help patients get a better result. He collaborates with leading manufacturers in the plastic surgery field and serves also as a key opinion leader, sharing his expertise to help shape the future of aesthetic medicine and plastic surgery. So, thank you both for taking the time from your busy day of running your practice and 10 practices in Southeast USA. Really appreciate your taking the time to tell us all the latest things about plastic surgery.
Oh,
And
thanks for having us. We're super excited to be a part of the show and excited to chat with you more.
Thanks very much. So I'm going to start with you, Dr. Cortez. Tell us about what regenerative era of plastic surgery is and how it's impacting the future of aesthetic medicine. Regenerative medicine is a hot topic that's spoken about more and more lately. So can you tell us about that?
Yeah, I'd be happy to. The cool thing with the evolution of our field is the fact that, before we would just want to restore what was damaged, or you want to give yourself a more youthful appearance. Now we're sort of moving into this new generation of, hey, how do we make things better? Right? How do we regenerate tissues? How do we make things look like they were 20 years ago and not just restore it, but actually regenerate it? The whole process, and it's really unique, interesting, and there's a number of different modalities that we ultimately do and use to be able to recreate that process, and that's what the evolution of plastic surgery is going to nowadays.
Right. So it's actually almost reversing aging, Dr. Bahardi. In the past, we just tried to kind of slow it down. Can we really reverse aging at this point?
I think that's the goal. I think everybody's eyes are wide open now about longevity, about kind of improving where you're at. And, so many of the historical things that we've done is that you take something that's broken and fix it. Then we got introduced to this idea of prejuvenation, like using things like neuromodulators, Botox, Dysport, Jeuveau, Xeomin to prevent deep wrinkles from being, from being static versus dynamic. And so we started this a while ago, and then using fillers and different things, and obviously there's surgical interventions, but using regenerative tools or technology, what you're doing instead of just filling something up or freezing something is you are revving up your own body's endogenous response. So things like biostimulators, things like recombinant platelet derived growth factor, they are activating what you already normally do. And so that's the idea of regenerative, is that you're using something that's, potentially that is already there, or something that is synthetically added to rev up what you already do at the same time. So it's obviously there's some exogenous thing that's added, but your endogenous pathways are actually leading to the change. And I think that's really a remarkable thing.
So these are things that we have in our bodies and in our systems, but we didn't know about them in the past. But now that we understand the medicine and science better, we can apply that to making people look better, feel better, and actually slow down or even reverse aging. That's pretty amazing. So, Dr. Cortez, tell us about the holistic approaches in plastic surgery and how you're combining new surgical techniques and procedures with those holistic approaches.
Part of the process of analyzing a patient is really understanding who they are as an individual. Do they sleep well? Do they eat well? Do they work out? Do they smoke? And encompassing all that in regards to their end outcome. They come to see us because they want a breast augmentation, but that may not be it, right? They may want liposuction. And if we can go down that road and do that surgical intervention, but if we're not looking at the whole patient and saying, hey, ma'am, you may not want to smoke, or you know what, you're not eating healthy. We got to look at the entirety of that patient and give them a holistic approach to their outcome. Say, listen, we can do this procedure, we can do it well, but you're going to need to do your part as well to maintain those results. And that is kind of the part of this holistic thing that we're moving towards. Is not only the actual surgical intervention, but it's the lifestyle modifications that go along with that.
Right. If you get those lifestyle modifications real well, you might not even need plastic surgery. You're going to put yourself out of work.
Well, I mean, the crazy thing is, yeah, I mean, a lot of people say, yeah, if you do that, you won't need some surgery, but there's always room for enhancements in certain areas.
Right.
If you lose a lot of weight, there might be a little excess skin that needs removed, or you still might have a little adipose tissue in a certain area that no
Right.
matter what, through diet and exercise, you can't get rid of.
Right.
And
Right.
I'll tell you the thing though, is that if we can help somebody or help a patient make a change to live a better life, to add to their life and not need our services, still a massive win. And so we're okay with that. I think that that would be an important piece. And it's an interesting thing because you think, all right, plastic surgery or aesthetic medicine, kind of what's that have to do with real health? The truth is, it's really important because your aesthetic well-being is obviously directly related to your generalized well-being. And so it's funny how we realize that, it's important for us to really take the time with our team, with our patients, to help people be aware of what they need to or could be doing, in addition to seeking our tools like surgery to better themselves and their lives. So it's really very interesting how the paradigm has shifted in our space.
Right. So basically, the basis or the infrastructure is this wellness, integrating wellness and longevity, and eating well and exercising and avoiding cigarettes and alcohol. But then you can do the plastic surgery because the aesthetic appearance of a person has great impact on their psychological well-being as well. So it's not only physical, it's also a mental benefit as well, right?
They're so correlated. I mean, how you look affects how you feel about yourself and
Right.
vice versa, right? And so if you feel well, you're going to want to do more activity and do the things necessary to make you look good. So they're so tied together.
Yeah,
That's
and
one
one
of
of
the beauties of what we do, right? It's like that's one of the main reasons that drives G and I behind what we do is we really change people's lives. And that's ultimately why we came to be, aesthetic surgeons.
one one
Right.
one of the big things though that why we feel a very important need and unmet need and gap in people's wellness journey or their aesthetic wellness journey is that we have countless number of patients who they feel good, but when they look in the mirror, it does not correlate with how they look. And so there are often times when the aesthetic has to be brought into the same kind of state as their kind of generalized well-being. And so one of for the simplest terms, they want to look as good as they feel. And so we can reconcile that. And I think that's a really impressive thing because people really now are really doubling down on taking care of themselves, eating better, eating organic food, staying more active. And it's funny, like what, a little case in point example is the healthier you are, the leaner you are, as you age, your face will lose volume. And so aging will actually kind of speed up in people's faces. And so by using some of these other regenerative modalities, like we talked about earlier, you can kind of slow that down. So there's this thing about like optimizing yourself from a health standpoint, then optimizing yourself also from an aesthetic standpoint. And we're not even talking about these GLP-1 inhibitors and things like that too, where we really directly fit into it. But it is really interesting how there's this absolute interplay in physical aesthetic well-being and your actual true generalized health well-being.
Yeah, you're absolutely right. When I get up in the morning, I look at myself in the mirror. If I think I'm looking good, then I feel better the whole day and I'm ready to go. If for some reason I didn't get a good night's sleep or ate too much the day before, I don't look that well, look kind of puffy, it kind of ruins my day mentally. So the aesthetic appearance is really important to people. Everybody looks at themselves in the mirror. So, Dr. Cortez, tell us about the leading treatments that you do to repair, renew, and restore patients for lasting results.
I think one of the biggest trends that we are seeing in our practice and practices across the country is the evolution of fat grafting. People originally didn't really know much about fat grafting, and now as time has moved on, more and more patients are learning more about it. They're like, "Hey, doc, I like the thought of what fat can do instead of these synthetic fillers that are out there." And so when G and I do fat grafting, a lot of the places, you can put it anywhere in your body. You can put it in your face, you can put it in your hands, your breasts, your buttocks. You know, it became mainstream because a lot of patients wanted bigger booties. And so this kind of Brazilian butt lift came about through fat grafting. But in essence, you can use that fat in a number of different locations to really enhance, a patient's appearance. And the cool part is, I think that's one of the mainstays of regenerative plastic surgery is the fact that we know that fat not only gives the volume, but that what it does to the actual tissues that are there and the skin quality that goes along with that is pretty amazing. When you say, G, like what are you seeing with patients wanting fat grafting?
Yeah, no, I think it's an interesting tool. The most important thing with fat grafting is it is a valuable adjunct. When we say adjunct, it is something that we can do standalone, or it can be done in addition to other interventions, like breast lifting, like buttock enhancement, like hand rejuvenation, or facial volume enhancement with other things. And I think it all ties into one thing is that the reason why we do fat, and this is a really simple concept, and this is a primitive concept that we learn in aesthetic surgery and plastic surgery in our training, is replace like with like. So you're replenishing tissues with tissues that the patient already has. And the interesting thing that happens is like when you surround yourself, they always say when you want to be successful, you surround yourself with good people. It's the
Right.
same kind of thing with tissues. And there's this something called a paracrine effect. When you take something like fat, put it around in a new place that you've transplanted and put it in a new place, it will take on some of those properties, and it will be almost kind of like the stem cell type of situation where it will actually rejuvenate, improve the soft tissue construct, the texture will get better. And this all ties back into this concept about the phenomena of like kind of what we're really moving towards, and what the most important thing from our goals are, and like what we're doing for patients. The biggest thing is undetected, natural, elegant results. That's really what HKB is very much about, and absolutely takes the biggest pride in. And I think finally in popular culture, that's becoming more and more seen. You can see these social trends are finally changing to more elegant things. The Lindsay Lohan thing that came up recently, the
Right.
Donatella Versace, and all this thing of kind of like going back, it's like everybody's like, oh gosh, we got to unwind this. We need to look normal, elegant, and aging gracefully. And to the point where no one knows. And I think that's the biggest thing, right? We don't want our work to be known. We just want
Right.
it to be their personal best.
You want it to look natural, like you're just getting younger, but didn't have the surgery to look younger. So let me ask you, I'm dying to ask you this. Where does the fat come from? What part of the body are you taking the fat? And what parts of the body are you putting the fat? Where are you transferring it to?
Yeah, I think that's one of the best parts of this operation is you get to remove unwanted fat from an area that, hey, you're tired of. Love handles, hips, back, stomach, and you're able to put it into pretty much anywhere that you want to add volume. And again, like G was saying, a lot of our patients do it as add-on or adjuncts to other procedures we're doing. If we're doing a breast lift or we're doing a tummy tuck and back liposuction, in essence, we're trying to reshape the body using that fat. And so it's the removal in one area and the addition in another area that you can ultimately reshape that patient.
Right. Without getting too technical, how do you take the fat out? Nobody wants fat around their belly. That's 100% certain. So do you take it out with a needle, and at first you anesthetize or numb the area, and then you inject it with another needle into, let's say, the face, if somebody wants to fill their face, or if they want to have enlarged breasts?
Yeah, the ways that you use it utilize kind of liposuctioning techniques typically to get the fat. So, yes, you're right. We typically will anesthetize or numb the donor site, and that's done with dilute numbing solution. If it's a big area, if it's high volume, then we use something called tumescent, which is just a hyperdilute numbing solution. Often that can be done under local anesthesia, meaning just that tumescent anesthesia. But if it's going to be a larger volume, a lot of areas, then it can be done under actual formal anesthesia, either IV or general anesthesia. That fat, the most important, Bill mentioned this, is that when you're performing liposuctioning for fat grafting, our priority is just as much as getting that area you're going to fat graft to look good, is that donor site has to look really nice afterwards. So
Right.
you want to do a really special liposuctioning technique. So we ascribe to a couple of key methods. And I'll just give an acronym. It's called SAFE, and it's one that was pioneered by one of our good friends, Simeon Wall, in Louisiana. And it is the concept is separation, aspiration, and fat equalization. All that means is when we remove the fat, we do it in a way that doesn't leave contour irregularities afterwards, so that it looks nice after. And then when you take that fat, depending on how much volume, will dictate how you inject it. We use some novel techniques that we kind of came up with by using other people's kind of teachings for like the breast and buttock, where we use something called an EVL method, where we kind of use a power assisted injection in larger volumes. But like in the face, we'll use a much more finer cannula. And so there's situations when you do super small micro fat grafting, and then you do kind of larger kind of degree, kind of what we would call macro fat grafting.
So it depends where you're injecting it to and how much you want to
Mm-hmm.
inject. Now, the fat is made out of cells. There are fat cells. These cells survive from where you remove them and where you're putting them in, and the blood supply provides them with nutrients.
Yeah, not every single cell that we put in survives. And so we like to tell our patients, you're not going to get 100% take rate of any of the fat that we ultimately graft into that particular area. And everybody's the next logical question was how much? Well, if it's definitely variable, and we say as much as is possible. We don't give an exact percentage on what ultimately takes, but we let them know that not every single fat cell that is injected it survives. And ultimately, that leads back to a technical point. When we do fat graft, we actually have to process that fat that we remove through liposuction, because you have all the fluid that you injected, the numbing agents that we talked about, and sometimes you get a little blood, and sometimes you get a little oil that comes around out of the fat itself. And we process that and then really purify that down to isolated fat cells as best we can. And that is what is re-injected back into the body, so that by doing that, by processing that fat, we get a better take rate or better graft survival.
That's pretty amazing. So those cells are surviving and living. It's great. So, Dr. Cortez, tell us about your med spa that you have at your practice and the regenerative services and how they integrate with the actual plastic surgery treatments that you do. How do you combine all of those to give patients the best result?
Yeah, every one of our locations has a med spa associated with the plastic surgery practice. And it goes back to this belief that we're taking care of that whole patient, right? We believe in aesthetic wellness. And part of it is sometimes they need neuromodulators or fillers, biostimulators, sometimes they need surgical intervention. And they're not going to ultimately get each treatment every time they come into the practice. But we really want to evaluate and take care of that holistic patient. And we believe that it's necessary to have all that in one house so that the patient knows that they're taken care of from start to finish and that we are there with them for their whole aesthetic journey.
And every patient is different and needs different things. So, Dr. Bahardi, how does experience and your expertise enhance the patient outcomes? I assume this takes many years of training and then experience to get these fantastic results.
Yeah, I think that, the mentors that we've had along our careers have been incredible and very valuable to us. What people don't realize, and I think you start to realize when you've been doing this long enough in any aspect of medicine or anything in life, is that you're learning every day. And so one of the things we're trying to do is we're just trying to get better continually. It's one of the reasons why I joined Dr. Cortez and Dr. Hunstead, who has recently retired, and why we're bringing others on with us, because we challenge each other and are in a continued state of learning and trying to advance what we're doing. And this idea of bringing in regenerative aspects into plastic surgery are so integral into us getting better outcomes. All of us have gone through rigorous training from a medical school standpoint, then general surgery, and then plastic surgery, and then others have done extensive fellowships. And then I think the biggest thing too is really learning how important it is to engage with our patients and to understand what their real goals are. At certain points, we have to redirect and inform patients too about what's available, what's new, what could be potentially good for them, or what could be deleterious to them. And I think that has served us and continues to serve us well. And then the last thing is, if there's an issue, to recognize that issue and deal with it, even if it's something that you wish you didn't have to deal with.
Right.
So I think it's very rewarding. I think we're getting better and better. We don't have all the solutions, but I think we're able to do nice things. And one of the most important things about us, and we've done, is we're embracing all the other tools that are available from a standpoint of helping a patient achieve their personal best from an aesthetic standpoint, and not just only relying on surgical interventions. We both love to operate. We love it. It's the
Right.
best. The operating room is the best. Doing big, huge cases is amazing, but it does pain us to have big, huge incisions and big recoveries. Ideally, if we can shorten things, make things easier for patients, that's where the magic happens. And so I think that we're getting to get better and better, and we're going to keep solving problems.
Right. So the key is to customize treatments for every patient. Every patient is different, and you're getting more and more tools and experience as time goes on to be able to do that. But Dr. Cortez, as you mentioned something earlier, which is interesting, and I'm an ophthalmologist, but my patients, many of them have plastic surgery, and they tell me about their experiences. And many patients, almost all patients now, want undetectable surgical results. They don't want anybody to know that they've had surgery, and they want to look great, the morning after. How do you supply that kind of result and keep up with those kind of increasing demands for perfection?
Well, I mean, I think it's to be expected, to be honest with you. Again, as a patient myself, and Dr. Bahardi's been a patient, we want the same things, right? Like, we want to be able to have these procedures. We don't want anybody to know we've had these procedures. Well, we don't really mind telling people, but in essence, like,
You guys both look like you're teenagers, so
I
that's
mean, the
great.
key, like we tell
Not
everybody,
necessarily.
is thank you, by the way, is I don't mind getting older. I just want to look and feel younger as I get older, right? Be
Right.
wiser and look the best that we can. And it is true. We want to do the best in terms of of doing undetectable results. And I think I always say the best plastic surgery goes unnoticed. And if you were doing a facelift, you want to avoid the telltale signs of that facelift. And there's techniques that you can do that. Same with eye surgery. There's certain things you can do to avoid the actual signs that somebody's had that procedure. Doing a tummy tuck, making sure their belly button looks good, making sure their incision's in the right spot. Those are the technical aspects that patients need to really understand when they go choose a surgeon. They do their homework and make sure that that doctor knows what they're doing. They've done a million of these before, and they can place the incisions in the right spot, do the right procedures so that it does go unnoticed.
Right. It's amazing. Yeah, the man's my patients tell me about it, but you have to deliver it. That's great. Um, tell me about the procedures and trends that celebrities are now doing that's spreading into the general public because they see the celebrities on Instagram, on the internet, and in TikTok. How is that spreading to the general public?
Yeah, the from a standpoint of what's on trend now, the pendulum has shifted. For example, large, big derrieres and big hips are now in kind of swinging the other direction. So those are getting reversed. People want small, perky for buttocks. Same thing for breasts, small, perky, natural. People kind of want more of this kind of ballerina type of breast enhancement. And so we have patients who are getting smaller implants or getting their large implants exchanged for smaller ones or even getting rid of them. Some people are just done with implants, want to be all natural. And I think the aesthetic for small and perky is nice. And people are embracing that. Some of the other things are there's been a little bit of a shift in filler. People are not getting as much filler, not having as that big hyper filled look. So the use of hyaluronic acid fillers is kind of receded just a bit. And now the rise of biostimulators, which are technically they're lumped into filler category, but what biostimulators do is it stimulates collagen production. And so you're getting actually collagenesis. So you're getting skin surface texture improvement, you're getting volumization, and it's ends up being their own tissue. So I think that's definitely on the rise. And I think more and more people are aware of that. And also there's an embracing of surgical interventions because people are realizing that some of these surgical interventions look way better than the non-surgical things. And then the end of the day, some of the costs associated with like 20 syringes is
Mm.
sometimes the same, if not more, than a surgical intervention that you can get a decade of duration.
And I think that one of the things, and I'd love to get your thoughts on it, G. I'm seeing more and more patients getting these surgical intervention, especially facial aesthetics, a lot sooner than they traditionally were in the past. You know, women would wait till their 60s or 70s to get a facelift, and then you could tell. Now
Right.
women are getting it in their late 30s, early 40s, just to make them look slightly better. And it's not as much of a drastic change, except for, wow, that looks really good. And so it's become more and more of a subtle change over time versus these big drastic changes.
Well, the biggest thing is that's the thing is people just want to look like themselves and they want to look like themselves all the time. So the truth is, having a facelift, for example, whatever it's in your mid 30s or early 40s, they just want to maintain that look. So they're like, well, what happens when I have my second facelift? Nothing. You're actually just retaining that look. So you,
Right.
you can have sequential interventions. But I think a lot of times that's what and I might be overstepping for some people, but a lot of people just want to maintain a specific kind of way that they view themselves once they get to that point. Other people might need to refine, adjust, reduce to get to that point, but then they just want to stay there. And I mean, at least I speak for myself and most of my patients. And I think that's the interesting kind of thing and why intervening at an earlier age, like Dr. Cortez is saying, makes some sense so that they don't yo-yo. You don't want to yo-yo how you're looking.
Right. That's a great point. I didn't think of that. If you're in your 70s and you have a facelift, it's pretty obvious that you've had that done because there's a radical change. Whereas if you're in your late 30s or 40s and things are starting to sag, the procedure you have done is not as radical and the changes are not as noticeable. And if you need it again in 10 or 15 years, the same applies, right?
Exactly.
Tell us some more about the biostimulators. that you're using?
This is right up G's alley.
Okay, no problem. Yeah. So biostimulators are a subset of injectables that have been around for a while but are gaining more traction. Some of the examples of these are um, Sculptra, which is polylactic acid, which was initially used for patients who had wasting of their face from HIV lipodystrophy. And people realized, well, if we can use this on these patients, what about treating patients' faces who have laxity and volume loss? And it worked beautifully. Another agent is something called Radiesse. Radiesse is a calcium hydroxyapatite biostimulator. So you actually get a little bit of, you get fill with it also, and you get a biostimulator effect. And then there are some other ones that are available, something called Renuva, which is a allogeneic kind of fat graft type of composite where it actually uses cadaver fat that has been decellularized, and it actually is a biostimulator as well. All of these agents are unique in the fact that you're getting some volumization effect, but what you are again doing is you are revving up what the body's response is. So you're basically augmenting what the body would normally do. And so you can get volumization from this, you can get skin surface improvement from this. And what's been really interesting about these biostimulators, they've been around for a while for specific indications, but like anything that's in medicine, basically you have to put it in the hands of the providers and they figure out how this is going to be useful. And so now some of these agents are using like Sculptra and Radiesse are being used in something called a hyperdilute fashion, where you thin them out significantly and they're using them in different areas, like for example, in the décolleté or in the crepey arms of the crepey areas of the upper arm or the lower extremity, where there was no treatment, you're using these and you're putting it right under the dermis, which means right under the skin. And it has this effect where the skin quality improves, the elasticity improves. And so people are getting beautiful responses. And sometimes you're avoiding a bigger surgical intervention, which is always very nice. And there have been some other advances that we've incorporated where we've brought in some different technology where we're doing things and combining it with biostimulators. And some of those technologies are things like microcoring, where there's a company that we've been partnering with called Elicor, where it's the analogy we would give is like it's like aerating the lawn. When you take cores out of the lawn, that can be done on a much more controlled micro level on the skin. And the area that it was initially used was on the face that has its indication for. And we have expanded that and using that kind of all over the body and getting tremendous results. And when you couple that with some biostimulators, you're getting situations where you can get almost a surgical like change. There's obviously it's different than surgery because you might have to do serial treatments, but it's nice. That's actually progress in our space where you can do something and eventually get scarless.
And can you combine the fat grafting with the various biostimulators?
Yeah, oftentimes we do. These combo modalities work really well together, and we
And
do.
that's where your experience and knowledge and expertise comes into play because you know which ones to combine and how much and where to put them, right?
That's all part of this kind of tailored individual approach that we do with every patient, right? Every patient has slightly different concerns and needs, and we sort of tailor a package for them based on their needs and their desires and wants and how quickly they want to see a change.
So, Dr. Bahardi, tell me why celebrities frequently deny that they've had any procedures done or fillers. They claim it's just they're eating better, exercising. Why do people deny the fact that they're having plastic surgery or other types of procedures?
I think that this is an interesting concept, and I think that a lot of people just are very private and would rather kind of keep people guessing. And I think people have a preconceived notion that it's like cheating, and it's like you're doing something wrong. When in truth,
Right.
you are really it's really empowering because you are grabbing the bull by the horns and you are in control of how you face everybody or face yourself each day. At the end of the day, these aesthetic interventions are for nobody else other than the individual that we're taking care of. And I think that's the key, and it is empowering. And so we can tell because when we see these patients come back, whether it be a big intervention or small intervention, when you see someone who kind of came in with a little bit kind of not necessarily mopey, but a little bit of lack of confidence, kind of rounded shoulders and coming back in, at their follow-up visit, chest high, strutting, smiling. And it's not every single patient won't beam and show that, but most people do. So I think that the times are changing. A lot more people are understanding and seeing that, man, you can look beautiful, elegant, like we mentioned before, undetected. So I think that that is changing, but I think a lot of people want to keep things under wraps. They don't want everybody to know their secrets.
Right.
I think it's fear of judgment. I do believe that you're going to be judged if you're doing certain interventions. And as you know, everybody's a critic, no matter what, and they're going to say something negative or positive in regards to what you do. And I think they don't want to open themselves up to that sort of potential negativity.
Right. So, Dr. Cortez, what effect has social media had on aesthetic trends and patient expectations? And especially now with the use of the GLP-1 drugs, Ozempic, for example, a lot of people have sagging skin because they've lost a ton of weight very, very quickly. So, how is that impacting your work these days?
I tell you, social media is a huge influencer on the aesthetic world. And as you would imagine, whatever you're seeing on social, that's what all your patients want to look like. And unfortunately, with AI and everything that's going on and filters, you can't navigate what's real and what's not real. But to patients, it's all real, right? And that's ultimately what drives them to want to look a certain way. And oftentimes now there's been a huge drive into looking skinny, right? They believe that skinny is beautiful. And because the GLP-1s are so readily available, they're like, hey, let's just do it, right? Well, what's the negative? What's the downfall? But unfortunately, it's not all great. I think that it's a really good drug, and it's a really good drug for the right individual, but it's not for everybody. For instance, if you don't work out, you can get severe muscle wasting, severe. And once that muscle is gone, especially if you're an older patient, it doesn't come back. It is almost impossible to come back. And then all of a sudden you look gaunt, and you lose fat and muscle in areas that you ultimately really do need it. Now it can work remarkably well. And in certain individuals, I think it's a game changer for folks where years past people were getting these huge surgical interventions, bypass surgery. They were doing gastric sleeves. They were doing these bands around their stomach, anything possible to lose weight. I mean, even putting balloons in their stomach, which is crazy to think about, right? Now, all of a sudden, with a shot, you can achieve the same ultimate results and reversing diabetes, and all these other, cardioprotective, kidney protective. It's like I said, it's a pretty amazing drug, but it's got to be done for the right individual, and patients have to make sure that they continue to do exercise that enhances muscle growth. Because if they don't and they lose that muscle, it's gone.
Are you having to do more surgeries in patients who have sagging skin from taking Ozempic and the similar drugs? Have you noticed that?
Yeah, we do it routinely. I mean, you name it, belly, arms, legs, all over the place. And this is where fat grafting is a really good adjunct in those individuals because again, they've lost fat in the areas where they really do want it. Like Dr. Bahardi was mentioning earlier, the face and the buttocks are two areas. If you lose too much weight and that fat goes away, it actually enhances the aging process. And it actually makes you look much older than you really are.
Right. Are patients coming in with photos from what they see on the internet, social media, and even now they have these models that are actually AI. They're not real people. Are they coming in with pictures and saying, I want to look like this? Can you do that?
Yeah, it's not uncommon for people to have kind of goal kind of picks that they'll bring with them. It's interesting that in certain situations they're very helpful. They're really helpful for kind of breast enhancement procedures, just to understand what a patient's goals are. Sometimes they are helpful, or it can be deleterious. Some surgeons will report for things like nasal refinement or rhinoplasty. At the end of the day, it's always valuable to see what patients think is aesthetic and beautiful, because
Right.
one of the reasons why we've always liked pictures, it's not that we can deliver that result, but it's so we can understand what result they're looking for. Because often what someone verbalizes, what we process could be totally different ends of the spectrum. So we do like them, but I would have to say we were very clear with patients that, you are unique, you are special, you have your own individual anatomy, and we can't actually make you look exactly like somebody else, but it does give us an idea of kind of where they're going. So I don't think it's necessarily a horrible thing. I have some certain friends that are, it's like, I don't care what that result is. We're just going to focus on how you're going to be. And I think they have a good point there because they don't want to give them false expectations.
Right. Good point. So a picture is worth a thousand words, right?
Mhm. For sure.
Especially in plastic surgery. So, Dr. Cortez, as I mentioned in the introduction, that you now have practices in 10 different locations in Southeast USA. How did you manage to do that starting from North Carolina?
With a lot of hard work, good people to work with, a great business partner that goes a long way, and then partnering with the right individuals and getting the right team members. I think I can't stress enough how great it is to work with individuals who have the same goal, same passion for patient care. And that's what really led us down this road of, hey, we want to deliver the best possible care to as many patients as possible, and we want to give what we think is great, and we want to spread that throughout the U.S.
Right. Where are your other locations? I mentioned you have a few in North Carolina. What other states are you in?
So we're currently in Tennessee as well, in Knoxville, Tennessee, in Nashville, in South Carolina, in the Charleston area. We're in Texas, in Dallas, in Oklahoma, in Oklahoma City, and in North Carolina, we're in the Charlotte metro area, Huntersville. We're in Concord, we're in Greensboro, and we're in Chapel Hill as well.
Wow.
Um, we have some amazing things that are coming up in the future in different geographies. And I'll echo what Dr. Cortez has said is that it's been our success has been attributed to our team, our incredible partners, all of our surgeons, all of our providers, all of our people from the people who answer the phone to our patient care coordinators, our nurses. Everybody is marching in that same direction of safety and the best result possible, and most importantly, just trying to make people happy. And
It's a team effort.
team effort for sure, and we're very fortunate for that, and we just want to continue to spread that and create an ecosystem where our teammates are all taken care of, but also our patients are getting the best possible care in a very high end, luxurious fashion.
Right. So, Dr. Cortez, is usually practices like that that have grown and basically encompass large geographic areas are owned by private equity groups or similar financial organizations, which then start to dictate to doctors how to practice medicine. How did you avoid going to the private equity route?
Well, I'll go back to the hard work that G and I put in and putting in our own equity into this. And there's a reason behind it. There's nothing bad to say about private equity. I think they do a really good job in their own right. We feel that kind of in the aesthetic world, things are a little different, and it's not like traditional medicine, and it's not like traditional roll-ups. And for us, we think there's something unique in aesthetic treatments and aesthetic medicine, aesthetic patients. It's not always about the bottom line. It's about taking care of that patient and doing the right thing for that patient, and not necessarily dictating how things are done or done in a certain way. And so we went down this road of, we want to be a very doctor focused, doctor centric practice that looks after the providers, because we feel that we understand the concept of what it's like to take care of patients in this arena. And so that's why we've been focused on being private right now. Is we want to be very doctor focused, because I think we as doctors know how to take care of these aesthetic patients the best way. Nothing bad to say about private equity and money, but this is not purely about money. It's about taking care of the patient the right way. And it can't be about the bottom line. You can't have a business person dictating what implants you use or what
Right.
filler you use or how you take care of this patient. And so that's been our approach and why we've gone down the road of doing what we're doing.
That's your secret sauce. Have other practices around the country followed your template or tried to follow it?
We're not necessarily aware of anybody doing exactly what we're doing. I'm sure there are some similarities. There are quite a few capital backed groups that are already kind of happening and kind of consolidating. And our hope is that they all do well and do right by the patient, do right by the teammates. But I think we have something unique and something special, and that we want to continue to grow and seek out other really special partners. And all of our team who's with us now, I mean, they make it happen. They're making it happen with us. And I think there's a lot of the biggest thing for us is obviously patients achieving their personal best, but also Bill and I have really enjoyed seeing success in others, having people promoted from within and taking on more and more responsibilities. It's a really special thing. And I think anybody who's grown an organization kind of knows some of those heartaches, but also some of those joys. And we are enjoying that part. And it's not easy. And we're always trying to improve what we're doing. So I think that we do have an edge on any other group or platform in the country because of that.
That's great. So, Dr. Cortez, what do you tell medical students and plastic surgery residents about the future? What types of opportunities and options will be available for them?
Yeah, I think the future is very bright in the aesthetic world. I think we're just scratching the surface. I think it's going to be more commonplace. I think more and more, patients are going to be willing and wanting to have aesthetic services. So I think there's going to be a plethora of opportunities out there, both in the academic setting as well as in the private practice world. I think it's a great field to be in. Personally, a little biased, but I think it's the best field in medicine.
It is a great field. It's really art plus medicine. There's a lot of art involved in addition to just knowing the surgical techniques and the medicine as well. How does your practice differ, by the way, from plastic surgery academic medical center practice? How's it different?
By being kind of independent and outside of a hospital construct or a academic construct, we just have a lot more control. We can really control the process. We can really optimize efficiency. We can kind of make swift changes anytime. And so I think that's one of the things that's really valuable. Now, listen, academic places have some incredible depth also, where they can have, multi specialty, every single resource to their beck and call, and deal with like more complicated things like reconstructive issues.
Right.
So I just would never ever say anything negative or insulting about those institutions, because Bill and I are a product of one in particular at Wake Forest, which we hold very special in our hearts. But I think for what we're doing, we just can have more control, and having control over all aspects of the experience in patient care is really important. At our flagship location, we have 6 operating rooms there. We have
Six.
a large clinical setting, and we're able to keep people overnight. So we have all the kind of the hospital-like infrastructure, but it's under our control, and it's by people who are doing the same in taking care of the same type of case and situation day in and day out. So when you do that, you really maximize your efficiency, your productivity, and you minimize errors and problems. So I think that's why it works really well for us.
Yeah, you become very specialized, right? And as you become very specialized, it's like clockwork taking care of that patient. In potentially in a hospital setting, they may be doing a knee surgery, and then they got some other surgery, and then it's your aesthetic case. And so where here it's focused entirely on the aesthetic world.
That's very important. What about AI? AI is rapidly becoming the way to go in medicine, and especially in the non-surgical specialties. How is it affecting plastic surgery, and where do you think AI will be with plastic surgery in the future?
I mean, I can safely say on the business front, I think there's a lot of opportunity to help kind of with efficiencies around, medical charting, medical billing, dictation. I think those are all patient experience, making sure that the whole process of that patient coming into the practice and leaving the practice is a little bit more efficient. I think those are aspects that I think they're going to be on the forefront of AI, and I think they're going to be very great. Now, how it affects the surgical process long term, I'd love to hear what Dr. Bahardi thinks about that. But from the business side, I think it's going to be a huge advantage.
Yeah.
I know in other specialties, for example, urology, they're doing a lot of robotic surgery, and also in gastroenterology and other specialties, there's more and more robotic surgery. Even in ophthalmology now, there are a few companies that are trying to bring in robotic surgery. Do you think that's ever going to happen, where an AI computer controls a robot and actually does aesthetic surgical procedures?
I think it's going to become a tool that we'll be able to use at some point. I do think that, there are it will be something where we still have to have, an operator. You'll still have to have someone kind of really kind of honing something in. But I think it's going to be a great tool in helping patients in the decision-making process, in helping them really kind of see and understand kind of what where they're at and where they can go. One of the unique things about it is it has to get so smart that it will have to be able to kind of predict kind of what outcome a specific surgeon can do. That's the unique thing about aesthetic surgery, is that versus like a cholecystectomy, taking out someone's gallbladder, very definitive, boom, it's gone. There you go. And then you can reassess the anatomy. In something like a facelift or abdominoplasty, how will AI, show and render and show what that simulation would be until it learns? So I think the unique thing about generative AI is that it learns. And so I think there's probably going to be ways that we can utilize AI and it learn kind of how we behave, to where AI is so focused and honed in that it'll be a tool for like Dr. K and me to use for preoperative planning, for patients to simulate kind of how it's going to be, to using as a supportive adjunct to actually achieve and perform surgical interventions in a much more precise fashion. I think we actually, I used to be really scared about it, but actually, the more I understand it, the more I think about it, I think the more we want to embrace it. And I think that AI with regenerative technology those are the two innovations in aesthetic surgery. Everything else has sort of been around. All the energy-based platforms have kind of been around. The lasers have all kind of been around. Even like biostimulators have kind of been around. So I think that it is something that we are going to bring in. But I think Bill and I and our partners and team members will have jobs for a while, at least until the AI robots can do everything.
Right. I think AI is going to introduce new tools possibly that we haven't thought of up to now. I think that that will be beneficial. And you never see your gallbladder even after you have it removed, but you do look at your face every day in the morning when you're brushing your teeth. So it's going to be a while before AI can do what you do. So I'd like to thank you again very much for this extremely informative and educational talk that we had. I certainly learned a lot, and I'm sure the public and my audience will love it as well. So I want to thank you again for taking the time from your busy days to do this.
Yes.
Thank you so much.
Thanks for having us. This was great.